management. Maybe they felt like they didn't have enough experience, and I didn't want to stretch myself too thin amongst everyone to make sure that they had the support they needed in that first level of management, their first time being a manager. It's a very different job going from a registered sanitarian in the field to coming into the office and starting to learn budgets and grants and supervision and things like that. So I feel like this is a really great improvement. Okay, it's being recorded. Okay. I really love the way that this restructuring has happened. Our two deputy office chiefs, Myrna Motta and Shini Lin, and we meet together several times a week, and we are discussing what's happening on both sides at a higher level, so we can, build on our strengths and help each other with our weaknesses. And I think it's really helped kind of bring the two sides together. Another big event for us was we moved offices from the first floor to the second floor, and we didn't go far, but it did require us to pack everything up, to weed out old things, to kind of go through what we had and what we didn't have and move into a new space. So it took a lot of time out of our staff schedule to make that happen, and I just I'm super appreciative to our office that it was pretty seamless. We're still waiting on a few build outs, but we're in our new space, Suite 220, in case you guys need to mail us anything or find us. One thing that we really focused on in the last year or two is recruitment. With public health being so focused on the pandemic, it seems to have made it a little bit more tricky to find qualified individuals for our open positions. So we had to focus quite a bit of time on how we were going to recruit qualified individuals, how are we going to retain qualified individuals. The whole state really worked hard on addressing, some of the things changing even with the economy and salaries and things like that. And so I'm happy to say that right now Myrna's side is fully staffed, and I'm really excited to see how we all come together and work on our goals over the next year. And I think that having a full team helps just build momentum and enthusiasm, knowing that there's people around us to help support us in our work. Something else that was new for us this year is the NEHA FDA grant to help us work on our retail food standards. And we also have a collaboration grant that we want to focus on building a standardization program in Arizona, and getting out and meeting more frequently with the counties to have, candid conversation about how things are going for you, what we're thinking, what our vision and our goals are, how we can work together, how we can support you, what are your struggles, is there anything we can do to assist in that. So at this point, I will hand the baton to Myrna to talk about some more specifics, accomplishments. Actually, no, there's a slide, sorry. One other thing that we worked on this year is our strategic planning. And this was something that I felt would be a great opportunity for not only creating a strategic plan, but for team building. This was something I had done in my previous position with the Arizona Biomedical Research Center, and we had such a great experience in creating it and then implementing it. And when I left that position, I'm watching my replacement just pick up where I left off and doing such great things. And it inspired him to have his own vision and his own goals. And if you guys ever have the opportunity to be involved in your organization's strategic planning, I highly recommend it. It gives a voice, it lets you ask questions, it lets you be creative and innovative. And when you're not part of it and you get a strategic plan with these lofty words and things, it's harder to have some context to that meaning and what that is. So when you get to participate in the strategic planning, I think there's more value and meaning in that. So what we came up with is that our mission is that we protect the health of individuals and communities in Arizona by delivering innovative services and driving evidence-based change. Our vision is health and wellness for all Arizonans in the natural and built environment where we live, work, and play. And in our strategic planning, we actually took 2 days out of our week to get together on site in person with our program managers, deputy office chiefs, and myself. And we talked about, we used a few different tools. There's lots of tools out there. We used SWOT, so we went over our strengths, weaknesses. We used SOAR, so we talked about our strengths, opportunities. I'm blanking on A. Strengths, opportunities, aspirations, and results. And we had these big, Post-its on the wall and little Post-its, and everybody got to write whatever came to their mind. And we grouped those together and we came up with big themes, and everybody had a voice. Everybody got to help vote up or down certain, things that came out in this planning. So we could come up with a set of strategic priorities that we all agree on, that we can work on together across the two sides, from environmental services and environmental epidemiology. And I think that although our tasks for day to day are very different, we have a lot of the same goals. And I think that this process helped everyone see the value that our team members have, and to have a collective goal and a sense of where we're going. So we also had a garden, which is also called a parking lot, just this place to put ideas and things that came up that wasn't really a focus of what we were doing, but we didn't want to forget or lose.
Unmute. Unmute, they can hear me talking.
So we also came up with our core values. So ADHS had also done some strategic planning. They have set a set of core values for our agency, and we just added on 3 more. And we set our strategic priorities for the office. So our next step, actually, I'll talk about that in a second. I think at this point I can hand it off to Myrna.
All right. If everybody can hear me. So looking back of some of the accomplishments that we had this year, and I'll just give a little bit of program updates. I'll be talking a little bit about Sanitarian Council and give you guys a little bit of an update on that. I do want to thank Shauna Oliveira, because she's been instrumental in putting the meetings together for the Sanitarian Council, the council members themselves. I think I saw Jose is on. Thank you so much for helping us with that. For this year, we had total applicants that attempted the exam were 59. The exam attempts were 64. The number of passing results were 32. The rate per candidate, the passing rate per candidate was 54.2%, and the passing rate per attempt was 50%. And again, thank you to the Sanitarian Council for, reviewing all the applications every time that a sanitarian wants to be considered to take the exam. They help us tremendously by going through all the applications and going through the process. Our foodborne illness, EPI, and OEH process mapping, I think I missed a word there. So just to let you know, we've been working very closely with our Office of Infectious Diseases Services on an outbreak mapping process. More recently, there's been a multi-state Salmonella Litchfield outbreak that we've been working on. It's in California, Nevada, and Arizona have been implicated, and there's been a link to raw salmon and tuna. And we're working with county health departments and local partners on this outbreak. So we're meeting and going through the process of, if there's an outbreak, signal who contacts who, how do we start, the process of contacting partners and the things that we have to do within our office, with outside partners, possibly with CDC, and stuff like that. So that's going really well. We are still meeting. It's not finalized yet. And so we're still making progress with that. Rules. This year, we have been working with our Office of Administrative Counsel and Rules on a lot of rule things, rule items. We've been doing 5-year reviews of rules such as children's camps, lodging, public toilets, swimming pools. There's one regarding smoke-free Arizona, specific for retail tobacco stores and the documentation that they have to provide to meet the criteria to be exempt. And we've met with the Governor's Regulatory Review Council and gone to those meetings. In fact, right now we're working with the Smoke-Free Arizona Act, and like I was saying, there was a comment period open. Stakeholders were invited. We didn't receive any comments about that one, but there's also the bottled water rule making right now. Again, there was an open comment already. The comment period is closed at this time. We received comments, we're going through them and making changes to the rules for bottled water. And we will let you know as soon as we have something else for comment period. The self-assessment and verification audit workshop. We just want to let you know that we are working with our FDA retail food specialist, Catherine Del Mundo, and we have a tentative date of March 6, 7, and 8 to have a SAVA training, the self-assessment and verification audit workshop for retail food standards. And she'll be with us hopefully that week in March, and we'll be inviting all county health departments to send representatives from your office who are working on program standards. And let me see, standardization. So Jenny touched briefly on this. We are working with FDA to have one of our staff be standardized and be the state standard. And what we hope to accomplish, of course, is to help other county health departments get staff that would like to be standardized on retail food inspections. All right, and manufactured food standards. Another shout out to our team member, Melissa Milan. She's been doing a lot of work with manufactured food standards and putting together all the standard protocols. She's been hard at work, and we at some point will be able to share those SOPs with county health departments that are interested in participating in the manufactured food program. And with that, I will hand it back to Jenny.
All right, thank you, Myrna.
Mm-hmm.
All right, so looking forward, I'll run through this pretty quickly because I noticed the time. We want to continue our strategic planning. We want to bring this down to the program level where we engage more of our staff in the strategic planning, and we set our goals, align them with our grants and our mandates. Like I mentioned before, we have started county visits. We want to continue those and go out and meet all of you. My big goal for this year is to get this internship program started. So we have a vision that ties back to our need and our difficulty in finding qualified registered sanitarians in our state. And I've heard from counties that you guys also sometimes have these same challenges. And so the vision is that we create an internship program where we're working with local universities and colleges to identify qualified students or recent graduates who would like to become registered sanitarians. And we want to work with the colleges and universities to make sure that their curriculum will set students up for success when they try to take the RS exam, that the students are aware of this as a profession. So we want to do a lot of outreach with our universities and colleges, and then also recruit individuals who will come to ADHS and go through an application and interview process, some basic training, and then hopefully we can place them in counties for a set period of time, which hasn't been decided, for those counties that are interested in participating with us. We have a new evaluator position for our office, housed under the environmental epidemiology side. They will be helping all of our programs really evaluate what we're doing right and where we can improve. And then we are also focused on our innovation side on developing new initiatives and programs as they come. So more on that in the coming months. But yeah, so at this point, I would just love to thank all of you for your services to our community. Environmental health services are essential to a healthy community, and the work you do protects our citizens from foodborne illness, contaminated water, air, and soil. And we study the interaction between people and the environment to interrupt emerging threats. Our work was essential during the pandemic and helped to prevent the spread of a novel and deadly virus. So many of you were the boots on the ground, and it was a tough job at times, I know. So thank you for your dedication in public health for your hard work. I'd also just like to bring some attention to our speakers over the next 2 days. I reviewed the agenda, and I think our team did a great job creating a great lineup for you guys. I'm excited to learn more about new topics like wastewater-based epidemiology and emerging threats, updates on new approaches and to old topics like Vibrio, infection control, lead and copper. I'd like to welcome all of our speakers who are from our local universities, counties, and sister agencies, as well as our speaker from Southern Nevada Health District. So thank you, everyone. I look forward to hearing your talks, and I hope the participants have a great time. Thank you.
Thank you so much, Jenny and Myrna. Yeah, again, I'll reiterate what Shauna said. If there's any questions, you can just put them into the chat, or you can raise your hand. There's a button on your end. And if there is no questions, I think we can move on.